Okay, hi everybody. Thank you for joining us for another My Life As A. Today we are talking to a nurse. So we have Jenny with us today. Hi, Jenny.
Hi.
Hi. So Jenny, can you tell us a little bit about your job? You're a nurse, but you have kind of a special area in nursing. So can you tell us a little bit more about that and what you do?
Yeah, for sure. I actually am fortunate enough to work on a unit that it's called a maternal child unit. So we have my prime area would be pediatrics and a neonatal intensive care unit, which is sort of locally is just a bit of a smaller unit than the bigger hospitals with stuff. And we also get a chance to go and work with postpartum patients. So anybody who's had a mother who's had a baby, we work with them before they go home. And so we get a little bit of everything. My favorite would be the ICU, the neonatal ICU part though. I like those little babies.
Yeah, that must be a really nice job to work in sometimes when you see brand new babies all the time.
Oh yeah.
Um,
Yeah.
yes. So how did you get into pediatrics? Is that what you always wanted to do with nursing?
No, actually not at all. I said when I graduated nursing, I said I never wanted to work with kids and wanted to work in emergency or any sort of intensive care unit. And for most of my career, I've worked in emergency and pediatrics. So yeah, turned out that way. hmm
So what would you say, you obviously have a very rewarding job and a very fulfilling job. What is the very best part?
Um, well, there's a couple really good parts of it. I really do enjoy helping. In the current role I'm in, I really like working one-on-one with the families, helping them like with bonding with their babies and children, and like that family experience is really nice, and that opportunity to teach them and help them grow, and when their babies are sick, to help them watch them get better and let them go home with their parents. It's really rewarding at that stage when you get to say goodbye. And kids, you like the sick kids are they're very, sometimes it can be really intense when you have some really sick kids, but it is like I don't think I can describe anything else, being able to help families with the patients getting better, and like it's just a really rewarding feeling.
Yeah, I imagine it must be, yeah, it really must be something really special to experience. Do you have any special stories you wanted to share with us?
I'm trying to think of one that I can really tell. I actually, hmm, that's a difficult one with because it's hard to talk about patients, obviously, with
Yeah,
confidentiality. We do get kind of a unique, that's a hard one to tell.
maybe a unique experience
Yeah,
or yeah, like something that's really touching about your job or something. Yeah, something that you can, obviously that you can't share a
yeah.
lot of it,
I,
but
yeah, I do. We do work a lot with families. I would say we get patient, like in the NICU, you get really prem babies who've often been in the hospital already in Kingston or bigger hospitals, and then they come to our house, to our hospital, because to be closer to home and finish their, we call them like growing and feeding and working on all those last skills developed in utero before they're born. So oftentimes some of those ones are with us for like a month or more, and you get really attached to those families. You get to know them, you get to help them, and you get a good chance to watch those babies grow and develop. And it's amazing to see what they can accomplish in those few weeks with growing and developing, and the parents as well. It's nice to see them grow. And we do often get, my favorite part is when the families come back and say hi to us with their babies when they're bigger, or you see them out in public and they're like, oh hey, how are you? Sometimes you don't recognize the baby because they've changed so much. Really get that family, like it's just really nice. I like the connection piece of it.
yeah, yeah. So it's a really special job, obviously.
Mhm.
If somebody wanted to do this, what kind of advice would you have? How did they get started? What kind of education or skills did they need?
Well, to be in nursing, it's a 4-year degree or baccalaureate degree. So half in college and half you finish in the university. So it's a Bachelor of Science in Nursing degree that you need to be a nurse in general. For pediatrics maternity, there's usually it's experience. I got into it because I was in Emerge, had some pediatric experience, came up to the floor, and then there are a lot of extra courses to take to, they have one like neonatal resuscitation provider, so it teaches you all the skills to help the little babies. It's much different than adults, to help them when they're in distress as well. So there's little courses like that that you have to take. And pediatric advanced care life support, they're just add-on courses, which are usually like 2 days. You have to recertify them every 1 to 2 years often. And really any extra experience. I'm currently taking a certificate in pediatric nursing as part of an extended pediatric degree. So that's just kind of extra. I don't really need it in my current position, but it's more just you're always growing and gaining knowledge to continue on with best practices with your current practice.
Yeah. Do you think that there's any like special personality traits or characteristics that somebody would have to be really a good nurse and maybe a good pediatric nurse?
I think definitely in nursing in general, definitely communication and being able to connect with people, and like that communication is a big thing, being able to just communicate with your colleagues, with your patients, like, and teamwork is huge. You can't do it. I have a whole team. I might be the one person in the nursery, but I have a doctor, a social worker, a lactation consultant, like an occupational therapist. We all work together as one big team to kind of care for that one patient sometimes. So definitely teamwork. Pediatric nursing, I think you definitely have to like kids for sure. I feel like if you're not really fond of babies and kids, you might not really like pediatric. But yeah, mostly I think just being able to connect. You can learn how to connect differently with kids, even if you're not been around them. They're just different developmental stages that you kind of are aware of. And you learn that in nursing anyways. So it's just getting used to that, I think.
Yeah. So that's about it for questions. Was there anything else you wanted to share about your job, or any parting words or anything like that?
I think that as a nurse, you work a lot. You work a lot of nights, a lot of weekends, holidays, depending on what area you're in. But as a starting point, you can pretty much go anywhere with nursing. You can be in a management role. You can be in the community. You can be in a hospital. You don't have to stay in one spot as just a staff nurse. It's a pretty diverse profession. It doesn't just really mean one thing, and there's tons of room to grow on your education when you start with just a nursing, no, I don't mean just a nursing degree, but you can just keep going. It's it's a good place to start. It's a hard job. You miss some family time a lot, but I sort of feel like those moments where like you see your patients in the community and they're like, oh, hey, how are you? Thank you so much for your help. It's like, okay, that's why I do this job.
Yeah. So thank you very much for all the work that you do. I know that especially right now, this is very difficult time in hospitals, and probably really scary. So thank you for everything you do, and all your colleagues for everything they do.
Well, thank you very much.
I know everybody really appreciates what you do, so thank you.
Thanks.
Yeah, and then also thank you for taking the time to talk to us and sharing your experiences and your knowledge. And I think that, you know, this is a really rewarding opportunity for people if this is something that they're interested in. So it's great that you have a chance to talk to people and give them a little bit more insight into what you do. So that's great. Thank you.
Thank you very much.
Okay. All right. So thanks everybody for watching, and we'll see you next time.